Good afternoon. My name's Graham Stretch. I'm the Chief Pharmacist at the Argyll Health Group, President of the PCPA and Clinical Director of a PCN in Hounslow, West London. Today we're going to be talking about the actual mechanics of performing remote consultations. I use those within my workplace where I lead a pharmacy team with 7 pharmacists and 6 technicians. We're part of a multidisciplinary team that provides care to 900 residents across 15 homes in Ealing. We provide care between 8 and 8, 365 days a year, so there's on-call at weekends and during holidays. Based in a single GP surgery, we have between 1 and 3 visits from a clinician each week to each of our nursing homes, and we ensure therefore that there's this continuity of care with single points of access phone numbers, single point of access emails. Over the last 7 years, this delivery of consistent care has seen a reduction in admissions to hospitals of around about 20%, a 40% reduction in unnecessary attendances, and good results around the reductions in the number of items prescribed, reduce of antipsychotics in dementia, and also 40% reductions in admissions for end-of-life care. Like most services providing medical and pharmaceutical care to care homes, we've experienced multiple COVID outbreaks in the homes, and we have unfortunately lost something like 180 patients to the virus, something like a 4-fold increase in mortalities. During that period, we've also experienced something like 1.5 to twice as many calls and interactions with our nurses and carers. In order to prevent our clinicians essentially acting as vectors for COVID, we've moved to a remote care system where we've found the use of AccuRx, which integrates nicely with System 1, of immense value. So let me demonstrate how this works. Within System 1, open up your, in this case, test patient. Once the record's open, click on the little green AccuRx toolbar and you can initiate a video consultation. Now, you can either do this using your phone or you can do it via a webcam. In this case, we'll be using a webcam. Click on the button that allows the link to launch in your browser. It performs a quick sound check, then opens up the video consultation screen. So that's how it looks on System 1. On EMIS, it's very similar. I'm going to use a video produced by the company to demonstrate how one could use it with your mobile. So AccuRx is the green toolbar. Click on the video icon. The patient's name and number is ported over automatically. There's space for you to put your mobile number in. Add the mobile number there and then click Send and Save, and an SMS will go to both the patient and to the clinician with a unique link for the video consultation. So we'll just send this now and change over to the patient's view. So I'm on the patient's mobile now. The text has come through. Notice that the clinician's phone number isn't shared, and instead you get a unique secure link. Click on that and it takes us through to this website where you can accept the use of your camera and your microphone, and you will see ourselves join the video anytime now. There I am, and hopefully there's a patient who you may well recognise. So if we're ready to get started, it's important to have the right admin rights, so you can give rights and access to the AccuRx software. Ask your admin or your practice manager. Hardware wise, whether you're using a laptop or a tablet, obviously you need remote access, VPNs, smart cards, etc. What I would suggest is if you're using a webcam, that's fine, but you need 2 monitors really. You need to be able to have your video consultation and at the same time be able to look and add to the notes, prescribe, and so on. Also a spreadsheet with contact numbers and so on, very important, and just think about the environment. You'll also need access for printing, scanning, and emails and so on. In this video with Jeremy Welsh, a GP in Gloucester, he's doing video ward rounds. You can see nice layout. He's got his video phone on the desk there separately to his computer with access to the records, so he can have consultations with the patient without having to switch between screens, and that means that he can look in the notes, he can check things and do prescribing as he's talking to his patients. Important to prepare for your video ward round. Agree a time with a nurse so she knows to, or he knows to expect your call. Be realistic about the number of residents you can get round and the time that's going to take. Make sure your IT's all set up and the devices are fully charged. And obviously try and be somewhere where you're not going to get disturbed. It's ideal if you can get the home in advance to send over a list of patients they would like reviewed with the basic obs, their blood pressure, BMs, oximetry and so on. Ideally you know the presenting complaint, because that way you can have a quick look in the notes in advance and have an idea about how the consultation may go, although you'll always be surprised. When you've agreed your actions, perhaps email them back over to the home with those actions for the home and the pharmacy. Send it off to the pharmacy so they're fully in the loop, and when you're prescribing, be clear for the pharmacy about how urgent that might be. Send tasks, book up, follow up, so that you can make sure the patient's reviewed when they next need to be. So at the agreed time, send over the link to the nurse so that you can join your consultation.
Hi Graham.
Hi Jolly, hi.
Hi, I'm calling from the Green.
Hi, you were asking about Mrs. Smith.
Yeah, I do. I'm a bit worried about her because she's complaining of headache.
Okay.
And she's a bit withdrawn. And she's complaining that she's taking too much of the medication.
Too many medicines. She said that before, I think.
Yeah.
It's
said it's really too much.
Okay. Should we go and have a chat with her?
Yeah, sure, no problem. I'll take you to her room.
Okay, thank you.
Thank you. I'm walking now to her room.
Okay,
I'm
brilliant.
walking on the corridor. Hello.
Here we go.
I got Dr. Brown on the phone.
Hello, Mrs. Smith. How are you this morning?
Not too good.
Oh dear, what's happened?
Got a bad headache and I'm taking all these bloody pills and I don't like it.
What
are they doing to me?
How many is it you're taking now, Mrs. Smith?
7.
Okay, so is that every day you take 7, or is that 7 in the morning and 7 in the evening?
I take some in the morning and some in the evening.
Right. And when you're doing that, do they make you feel sick? Can you swallow them okay?
I'm given a drink so they go down and I take them one at a time.
And how do they make you feel?
Well, I don't think they make me feel any different. Why have I got a headache?
Yeah, so you don't think they're helping you at all?
No, not really.
Maybe what we should do is go through them one by one. And so the consultation would continue. So I think when you use a video, you can obviously pick up on some of these non-verbal cues. Some of them we saw with Mrs. Smith. You know, posture. How's the patient sat? Are they facing away? Are they reserved? Are they trying to shy away? Are they agitated? Their body movements will give away quite a few signals as well. Are they fidgeting? Are they uncomfortable? Often patients, particularly when they have a later stage dementia, will often use facial expressions, and you can tell whether they're wincing, whether they're crying, whether they're sleepy. And actually eye contact, of course, is hugely important, although that's a little bit difficult because people feel a little bit unnatural, certainly the first time that they use a video, but all of that's helpful. Of course, you can use the video to look at specific signs and symptoms as well. The next couple of examples, we're going to examine someone you probably recognise eye, together with another clinician in an MDT fashion, and then actually you can use the software and ask the nurse or carer to send in a photograph of generally a dermatological condition. Here we've been sent a picture of some psoriasis made worse by repeated hand washing, common of course during the COVID pandemic. On Friday, the Royal College of General Practitioners issued some very helpful guidance around staying safe, protecting patients during video consultations. I've added a shortcut link. So that concludes my presentation on video consultations in care homes. Hopefully you have a flavour. Ideally you get some practice and test the IT. Make sure your time's well organised, and then when you finish your consultation, make sure you're concentrating on getting good notation and communicating well with the home and the pharmacy, particularly where there's urgency. Once we reach the recovery phase and post-COVID, I suspect the tools and the video consultations will continue to be used in some kind of mixed model where both face-to-face and video have a place in our continued practice in care homes. Thank you.